All right, next I'm going to talk about getting into some of our fertility drugs now. You'll see most often the fertility drugs that we use are either Gonal F or Follistim. Doctor's preference, truly Gonal F and Follistim really are the same. They're recombinant gonadotropins. This is pure FSH, follicle stimulating hormone. This is what's going to be growing the follicles for you. Every now and then you might be in treatment where your doctor's choice of FSH might be Menopur, or which is a form of FSH and LH, Brevel. Most often though it's Gonal F and Follistim. Now, again, different docs allow you to use these interchangeably. Maybe your calendar says Follistim, but you've got some Gonal F left over. Again, it depends on your doc's preference. Check with your coordinator if you're allowed to use them interchangeably. Now, Gonal F comes in two formulas. It comes in a multi-dose formula and it comes in a pen formula. Again, your coordinator would have prescribed one or the other. The truth is these certainly are interchangeable. What format you use, it's the same exact medication. Gonal F multi-dose comes in either 450 units or 1,050 units. Either way, it looks exactly the same. I'm actually not going to break this open and use it just because these are so expensive. But I certainly want to just show this to you. This is a pre-filled syringe of water. It's got a needle already on it. And it comes with a little vial of powder. I just need to take that cap off and inject that water into this powder. And in this case, I have then reconstituted 450 units of Gonal F. Now, of course, if my box said 1,050 units of Gonal F, that is what I would have reconstituted. This is why this is one of my favorite products. If you actually read the back of the box, it will explain to you that there's overfill in these boxes. This 450 unit Gonal F actually contains 600 units of medication. I like this because that's real medication, that's extra medication, and that can save you a little bit of money. So I happen to be a fan of the multi-dose. Now, once you reconstitute it, easy enough, right here in the box as well, they send you special syringes that are already marked off in common Gonal F doses. Now, you'll look at your calendar to see what your doctor has prescribed for you. But right down the side of the syringe, there it is, 75, 150, 225, 300. And in this case, it goes all the way up to 600. So depending on what your dose is, again, this is a multi-dose vial. If my dose were, well, say it was 300, I would just simply draw out 300 units. And this comes with a needle, right? Little sub-Q needle that we're familiar with. And we're just going to draw out whatever our dose is. If it were 300, I would draw out 300 from the vial and do my shot, tummy or leg, wherever I prefer to do it. Now, of course, because I know this has really got 600 units in it, that vial contains about another 300 units of medication. So I'm going to put that in the fridge for the next night. Now, if I ever find that I am a little short, maybe the next night I go to draw out my dose and I'm supposed to take 300, but maybe when I draw it out, I'm a little shy. Maybe seems like I'm drawing out 225 or what have you. That's okay. Usually your coordinator would have ordered you more than one. Just open yourself up another multi-dose and continue to draw out. Doesn't matter whether it's 1,050 or the 450, it's all the same concentration, and you'll just continue to draw until you get to your dose on the syringe. And that is how multi-dose works. Like I said, it's one of my favorite little guys. Now, this is the other way to use Gonal F. It is the more, technically savvy way to do it, I guess. I'm just, I can't get the overfill out of it. That's why I'm not as much a fan of it, but it certainly is handy and easy to use. This is a pen. It comes with the medication already in it. Now, depending on what your coordinator ordered for you, you can get these pens in 300, 600, 900 units. And basically, uncap it. It's a pen. It's called a pen. And right there on the end, I simply have to attach a needle, and you'll get lots of needles right in the container here. It comes with it. These just, simple enough, these just peel right off. attach right on. This is just going to be another little sub-Q injection. There's that little needle that we know about. And we just need to tell this pen how much is my dose. Now, there it is right there. You see that little black arrow? We're just simply dialing up to our dose. And in this case, I said an example of a dose is 300. I've dialed to 300. This becomes actually my syringe. This just pulls out, and I don't want to expend it because I don't want to waste the medication. But literally, you'll just pick a spot on your tummy or leg, and this will just click, click, click down as you do your injection. Now, this is a 300 unit pen. Even when you're done giving yourself 300 units, you're going to notice there's medication still in this pen. That's that overfill I talked about. That's the tricky part, getting it out, because this pen won't deliver it to you. You can certainly save these pens up with their little extra medications and possibly even bring them to your coordinator to see if there's a way that she can try to collect all those little bits for you, maybe to make an extra night's worth if need be. Just again, so expensive. We want to try to save you some money. These generally, Gonal F is generally done in the PM, your calendar will say. And again, we're not terribly strict about what exact time that is. It's generally sometime between dinner and bedtime, but certainly a few hours don't vary as long as you're keeping it in the evening. This is, of course, what's growing the follicles for you, pure FSH. A lot of women wonder if taking, when you start to take these kind of hormones, if they're going to start, feeling kind of wacky and overwhelmed by the hormones. The truth is no, because this is the same hormone that you're putting out every month in the first couple of weeks of your cycle to grow a follicle. Now, granted, I'm giving you a lot more, but we don't tend to notice anything in the first couple of weeks of our cycle. And these drugs, these hormones, there's a lot to be said about the stress involved in doing all of this, and that making us a little bit, more unstable sometimes. But it's not really the medications, in that regard. Some folks will ask if they expect side effects from these, meaning ovarian, do I feel things? You know what? I've had gals with 20, 25 follicles, and they tell me they don't feel a single thing. I've had folks with 3 or 4 follicles who tell me they got cramping and pinging and twinges and all kind of things. So that means everything is normal. Everything is okay. Feel it, don't feel it, it's okay. And that's Gonal F.